This video will provide an introduction to your week on night float. Let's begin by reviewing the schedule. Your night float shift will begin at 6:30 p.m. in the 6th floor resident area when you receive sign out on all patients directly from the daytime late stay resident. The night shift attending will arrive at 7 p.m., at which time the attendings will conduct their own sign out on the 7th floor. At some point in the evening, the night residents and attending will visit the floors for night rounds. The exact time of this will depend on when the team reaches a good pausing point amongst admissions. Morning sign-out will occur at 6:30 in the morning directly to the daytime residents. Most days, you will leave right after morning checkout. However, on Mondays and Wednesdays, there will be morning report at 7:30 a.m., after which you are dismissed. The night team should also plan on attending Janus rounds when these occur. During your shift, you will carry the red team pager and be responsible for responding to floor calls. Floor pages should be returned as soon as possible, and definitely within 10 minutes. Your upper level resident or attending will inform you of new admissions. You will then see new admissions to complete a history and physical and to enter orders. Be sure to assign the patient a team and to mark the admission status as either inpatient or observation. Your upper level or attending should assist you in deciding these. When you are ready to discuss the patient, you should contact your upper level, or attending if no upper level is on that night, to review the case and plan of care. Update your upper level through the night and in the morning about any issues overnight. Most importantly, take advantage of downtime to read and learn. At some point in the evening, you will visit each floor with the night team for nighttime rounds. This will provide an opportunity to clarify plans with nurses, address nursing concerns, follow up on any outstanding daytime tasks, and check on any worrisome patients. This is also your opportunity to ask any questions that you may have, so you should be an active part of the process. The timing of nighttime rounds may vary, depending on admission volume and acute patient events. Your first couple of days, your upper level or attending may lead rounds, but by the end of the week, you should take over this responsibility. All new admissions should be discussed with the upper level, if there is one on at night. When there is not an upper level resident at night, all new admissions should be discussed with the attending. Patients seen prior to midnight should have notes assigned to the night attending. Patients seen after midnight should have their notes assigned to the day attending on the team the patient is being assigned to. The timing of a note is important and should accurately reflect the start of a patient encounter. A good habit to ensure this is to open a note before seeing a patient and then saving it in draft form until you are ready to complete it. For example, if you start seeing a patient at 11:45 p.m. but finish obtaining your history and physical after midnight, your note should be dated for the before midnight date. In addition to seeing all patients and discussing with the intern, upper-level residents should document a brief follow-up note on all admissions overnight. This should focus on highlights of the patient's case. All cross-cover events should also have a follow-up note. These should include any checks on washer patients, patients with worsening clinical status, and patients with significant parent or staff concerns. Remember, if you didn't document it, it didn't happen. In the evening, you will complete various assignments as part of the nighttime curriculum topic. The files you will need can be found in the S-Drive Doctors folder in the PHM folder. The necessary documents, as well as the checklist of assignments, can be found in your PHM welcome email. Interns will complete the assignments with the upper level or attending and obtain the necessary signatures. Upper levels, please remember to work through these modules with the interns. Obtaining the necessary signatures and turning in the checklist to the rotation directors will be the intern's responsibility. The rotation will not be credited as complete until the checklist and accompanying documents are turned in. As always, we cannot stress enough the importance of reading about your patients. As time allows, you should be reading about each patient that you see. Sometimes it can be helpful to spend a couple of minutes reading prior to entering a patient's room in order to best focus your history and physical. There are many resources that are available to you. For pediatric residents, the resident handbook is available on Blackboard. For all other learners, this may have been emailed to you. If you do not have it, definitely ask for it. It can also be found under the Resident Handbook tab in the Resident Binder that can be found on the 6th floor. The binder also contains helpful guidelines and articles to the most common diagnoses that we see in pediatric hospital medicine. You should refer to this often. Pediatrics in Review has very helpful, easy-to-read articles on a wide variety of topics. You may also use UpToDate, Dynamed, and of course, Harriet Lane. There should be a Harriet Lane on each nursing unit. Your upper-level resident and attending are always available to help you. Do not hesitate to call with concerns and questions. Situations when you definitely should contact your upper level or attending include decompensating patients, major changes in clinical status, and uncertainties you may have in providing care.